Hello, I'm Jawad. I'm the Executive Medical Director at East Lancs Hospital NHS Trust. This is my update on the 24th of June 2021. I'll begin with just running through some numbers of COVID positive in the community. Blackburn with Darwin is 487 per 100,000, Burnley 384, Hyndburn 483, Pendle 329 per 100,000, Ribble Valley 379, Rossendale 359, which brings a total in the conurbation as 414 per 100,000. Numbers are still high and they are not where we ideally would have liked to. And the figures are a bit waxing and waning, meaning by that community transmission is still ongoing. And that unfortunately is reflecting in our hospital admissions. As of this morning, there were 53 COVID positive patients in the hospital, and of those 53, 9 were in intensive care. What we are finding during this wave, which I think would be very reasonable to say is the fourth wave for our area, is that relatively younger patients are being admitted. They are also taking longer to be discharged from intensive care or from the ward due to the severity of the disease. And they are also of high acuity, meaning by they are much more sicker than what we saw in the first wave. So it is important that people take up the options of, or rather the offer of vaccine. And as you well know, government has now brought the criteria down up to 18 years and above. We have seen an increased uptake, which is reassuring. We are also seeing surge testing, which is therefore helping in reducing the transmission of the virus. And hence what I have been saying all along, that please do follow the infection prevention control principles, the SOPs, hands, face and space, hand hygiene, face mask and social distancing is still going to be the fundamental weapon that we need to use against this virus in reducing the transmission. The other thing which I wanted to just update you is that at East Lancs we are having this week as an area of focus on 4 processes that helps in patients' journey when they come through into the hospital. This is to improve the emergency department processes, improving ward processes, improving the frailty identification and its management, and finally launch of the enhanced intensive home support service MDT. This will help the patient's journey and will help facilitate their discharge to home. Hence, a big thanks to all the partners who have taken part in this exercise. We will obviously be learning some lessons from here and will implement it to make things as smooth as possible for our patients and communities. A&E attendances unfortunately still has been at quite a high level. This has been exceptional. We have seen some days as many as 700 plus admissions or other attendances coming through both our urgent care and A&E. The request is the same, that please approach your surgeries first. There is other facilities like local pharmacies and 111 service who will advise you accordingly. If the advice is that you need to attend to hospital, then that is what would be the case. However, rather than turning up at the hospital, we would advise to seek alternative measures before you think on that. Today we are celebrating the Pride Day at ELHT. There are various events happening in the organization, and we are very much supportive of our LGBTQ colleagues. We'll meet again in a couple of weeks' time with more updates. Bye for now.